The public health people, they, like you said, I think they are prepared at the airports. But for me, a clinician in the hospitals, I think that, probably like you said, we are still in the process, so maybe they are getting there. But I don't think the preparedness in the hospitals is adequate now.
Why do you say that?
Yes, so just before I got to the studio, I work in Kolebu, and then I was just called by some of my junior colleagues. Hey, they said there's a suspected case, And so I called the public health director in Kolebu, who actually is there right now. So he briefed me. I said, I want to know because I know when I come here, I will be asked. Now, so we were told that we had these two nationals. One is a Chinese, one is an Argentinian. And they just walked into the emergency room in Kolebu. Apparently, and this is what I was told, about 30 minutes ago before I walked in here. So they walked in. They didn't even come for a referral letter. They walked in. Apparently, they said they went to another facility. I won't mention the name. And when the people suspect, one is a Chinese, one is an Argentinian. So when they saw them with these Malays and all the same things, they were like, go to Kolebu. They didn't even attend to them. They said, go to Kolebu. But we were told that the centers are Ridge and Tema General Hospital. But they asked them, go to Kolebu. So there's a problem with even communication. So they also came to Kolebu, they walked and they got into the emergency room. And then everybody is panicking. There was not even a call to say, oh, we have these two people we suspect, so can we? So then when they come, everybody, those who are supposed to attend to them are prepared. We'll try and maybe put them somewhere and go through all the tests. But yes, they got into the emergency room, and according to the public health director, one of them, so the Chinese left China in September of last year. So we'll say that it wasn't within the period. But the other person who had been living with him actually got into he also was in Shanghai, but that was in January, and came down. And they've been living together. Now they all develop some symptoms that fits the case definition, but it doesn't mean they have to. They have some Malays. They say only one had catarrh, one of them had a catarrh, but with all the muscle pains and everything. So they've taken samples and sent to Noguchi, but we are taking another sample in the morning tomorrow. So I'm just using this as a scenario. See, are we prepared? If you realize, Ghana Medical Association, we sent a press release on the 31st of January, and these were the things we were calling for. The first thing is the communication line. So the first health facility they went to, if they thought that, okay, let's say they thought we are not prepared or we are not a center, what should they have done? They just said, go to Kolebu. So there's a problem with communication in the first place. And then when they got to Kolebu, now everybody is, I've seen people sending me a lot of text messages. Hey, we hear there's a suspected case. There's panic. What is the reporting like?
And this is important because this is among health professionals.
Yes.
So if the health professionals are panicking.
Yes. And they have they have the right to, because everybody is scared. On the lighter note, today I read a post, and I hear in Juba, some Chinese diplomats got to the airport, and the health workers, they had to flee.
So I heard they called them and said they should meet at the tarmac. So when the Chinese diplomat disembarked, they sort of test the person and take the sample. But they say the time the plane arrived,
because they are also afraid for their life. In as much as our members, the health workers, are ready to help treat and prevent the disease, their health must and their lives must also be catered for. So for example, for now, for this case in Kolebu, the people have been isolated, samples have been taken, but what about the health staff, the people they came into contact with initially? So I think we are getting ready, like he said, but we are not ready yet.